Knock, knock, knock. Hi, Joey. Hi, Mr. Joey. My name is Cassie Meyer. I'm a nursing student at the University of South Alabama, and today I'm going to be performing a neurological assessment on you, if that's all right.
Very cool, very cool.
Okay, great. So to begin, I'm going to assess the person's appearance. So I'm going to look at his clothes and see that they are the correct for the type of weather that he has. I see that his posture is upright. I see that his speech is understandable, and his that was the next part. His appearance still is his hygiene is good, and his grooming is good as well. So next I would look at his behavior, and so the first thing I'm going to note is that his behavior is calm, his speech is clear, and I would ask him if he's had any depression or anxiety over the past few weeks, or any suicidal thoughts. No? Okay, if the answer was yes, then I would get a further screening tool to assess my patient according to their needs. And the next thing I'm going to do is check their cognition. So I'm going to ask you your name.
Joey.
And what time of day, what time of day it is?
Evening.
And where are we?
My room.
Okay. And to check your recent memory, what did you eat for dinner?
Fish and veggies.
Okay, and to check your past memory, who was the president before Trump?
Obama.
Okay, and now to check his thought process, reasoning, and judgment, I'm going to ask you a phrase like find a needle in a haystack. What does that mean?
Something hard to find.
So that's reasoning. And judgment, where do you see yourself in 3 years?
Happily married.
All right, and so that is judgment. Okay, so next thing I'm going to test are his cranial nerves, beginning with number 1. So the first thing I'm going to do is ask you to occlude each of your nostrils and breathe in. Okay, and the other one? Okay, so his right nostril was a little stuffy, but that's all right. But the motor portion of the olfactory nerve is intact, and now I'm going to assess the sensory nerve. So I have 2 essential oils here, and I'm going to show you what they are. I don't know if you can read that, actually. I'm sorry. Okay, so I'm going to get you to occlude one nostril and close your eyes because you can. So the first one is
lavender.
Yes. Okay. And the second one, close the other nostril, is
Peppermint.
Yeah. Okay, so lavender, peppermint. So the sensory and motor portion of his nerves are intact. For his olfactory nerve, now I'm going to check number 2, which is the optic nerve. And if we were in the normal doctor's office, I would have a Snell and eye chart 20 feet away, and I would have the patient close one eye and ask to read the lowest line possible, and I would interpret the results, and they would be something like the patient can read at 20/200, which means that the patient can read at 20 feet when a normal person can read it at 200 feet. But right now I have a handheld vision scanner, so what I'm going to do is hold it 14 inches from your face, which is 2 of the card lengths away, so read the lowest line possible.
937-826.
Yes. Okay, so that is 20/25. So the patient, Joey, can read at 20 feet when a normal patient can read at 25 feet. So the next thing I'm going to do is, so that's the optic nerve, and the optic nerve is intact. So the next thing I'm going to do is check cranial nerve 3, 4, and 6. And so that's the ocular motor abducens and the trochlear nerve. And what I'm going to do is ask the patient to, I'm going to perform a series of tests called PERLAC. So the pupils are equal and round and reactive to light and accommodate and converge on their axis. So first thing I'm going to do is check their size and see that they are equal in size and at 6 millimeters equal and bilateral, and they're round. So next thing I'm going to do is check their reaction to light. So I'm going to shine it into your left eye and see how your pupil reacts. So his left pupil constricted, and that's direct constriction. Now I'm going to check for concentric constriction in his right eye, just if I shine it in his left eye. Okay, so his right eye constricted when I shine the light into his left eye. And next thing I'm going to do is ask you, Joey, to look far away and then up close in my hand. Okay, so his pupils accommodated, which means that they or dilated when looking at something far away, but converged when looking at something up close. And now I'm going to check to see if they converge on their axis. So what I'm going to do is get you to follow my finger to your nose. Okay, sorry. So both of his pupils converged on their axis. And next thing I'm going to do is check the the 6 cardinal motions, ranges. And so I'm going to get you to do is follow my finger with your eyes not moving your head. Thank you. And 3 more. Okay, so I noted parallel tracking and no nystagmus, which means that his 3, 4, and 6 cranial nerves were intact. And now I'm going to check number 5, which is the trigeminal nerve. So I have a Q-tip in my pocket. So close your eyes and I'm going to get you to say now when you feel the Q-tip touch you.
Now. Now. Now.
Okay, so the sensory portion of the 5, which is the trigeminal nerve, is intact. And now I'm going to test the motor portion. So I'm going to get you to, when you, no, you're fine. Just clench your jaw and I'm going to palpate around the temporal and the jaw. Okay, now I'm going to, keep your jaw closed and I'm going to try and open it. Okay, so the motor portion of his trigeminal nerve is intact, and now I've already done number 6, so I'm going to go to number 7, which is the facial nerve. So what I'm going to do is get you to make the same faces as me. So open your eyes and smile and frown and raise your eyebrows and make a puff out face. And I'm going to get you to close your eyes and I'm going to open them and you try to resist. Okay, thank you. So the facial nerve, motor portion, and sensory portion of the nerve are intact. So next I'm going to do the acoustic nerve, or the vestibular cochlear nerve. So I'm going to stand 1 to 2 feet away and get you to repeat the word that I'm saying. So cover one ear.
Sorry.
You're good.
No.
Okay. Baseball.
Baseball.
Okay, now the other ear.
Soccer.
Okay, so I covered my mouth and stood 2 feet away and whispered a word, and he got both of them right, which means there's the facial nerve, cranial nerve number 8 is intact, and there was no high frequency hearing loss. So now number 9 and number 10 are tested together. So it's the vagus and the glossopharyngeal nerve. Yes, okay, so number 9, number 10. So normally I would check his gag reflex, but I'm not going to do that. And another thing I would normally do is put something salty, sweet, sour, or bitter on that posterior, I'm sorry, I think I would just do something salty or sweet on the anterior 2/3 of his tongue and get him to decipher it. And next I'm going to check your uvula and see, say ah when I, okay. So his uvula rose midline and on bonation, so that is good. So that was 9 and 10, and now I'm going to go to 11. So that is the spinal nerve. So push against my hand with your face and on the other side. And now with your shoulders, push up as I push it down. Okay, so his spinal nerve is intact, and now I'm going to check number 12, which is the hypoglossal nerve. Yes, okay, so I'm going to get you to stick out your tongue. I'm just going to use the light because it is kind of dark in here. Okay. Okay, so his tongue came out midline without deviation, and it looked normal. And so now I'm going to get you to repeat these 3 words after me. Light.
Light.
Tight.
Tight.
And dynamite.
Dynamite.
So now repeat them all at once.
Light, tight, dynamite.
Okay, great. So the sensory and motor portion of his hypoglossal nerve, nerve number 12, is intact. So next I'm going to do is check your cerebellar function. So I'm going to get you to walk across the room first in a normal gait and then heel to toe. One minute, let me.
I can tell you whether or not it can see me.
Okay.
That's perfect. Don't even move it. Don't even move it.
Okay, and now heel to toe. Okay, great. Okay.
Standing?
Oh yes, thank you. So stay standing, and what I noted with his gait is that it was normal and rhythmic, and he wasn't swaying from side to side, so his cerebellar function is intact. And now I'm going to check his Romberg, so I'm going to perform a Romberg test. So I'm going to get him to stand a little bit in front of me and close your eyes, and I'm gonna put my arms around you to support you, and I would get you to hold this for 20 seconds, but for the purpose of this video, I'm not going to, so go ahead and sit down. And that is the Romberg test, and since he didn't fall or sway, it is a negative Romberg. And now what I'm going to do is check your senses of your motor portion with my device. And I'm going to actually readjust the camera. Okay, the first thing I'm going to check is your biceps tendon. And I'm going to, okay, so I'm going to put that right there. And okay, so I gave his muscle flexion a +2, and now I'm going to check his triceps tendon. Tell me if I'm hurting you.
Very good.
Okay, so that was a +2 response, and now I'm going to do is brachioradialis test. Okay, so that was a +2 response, and next I'm going to check his kneecap or his patellar tendon, and I'm going to, well, I need you to
Try to let it
relax
hang.
it.
Yeah.
Okay. So. Oh. So that was a +2, maybe a +3.
+6. I don't know.
It only goes up to +4. Okay. And next I'm going to check his Achilles. Okay. So I'm going to check his Achilles tendon. So I'm going to put my hand on his foot, and you can see I'm going to... Okay, so his foot moved down a little bit, so that was a +2 response, or that would be normal, is a +2 response. And next I'm going to do a Babinski's reflex. Okay, so normally if his toes curled under, it would be a negative response, but they did not, so. Okay. Next I'm going to explain to you that throughout, let me make sure I did everything. +2 nerves. Okay, so now I'm going to explain to you that throughout the procedure, I was using the Glasgow's coma test to observe my patient and test him. So it's a test that scales from 3 to 15, and 7, which is lower, means that the patient is in a coma-like state. However, I gave my patient a 15 because of the 3 sections of the test, the eyes, verbal, and motor portion. He scored the highest on each of those. For the eyes, it is a 1 to 4. For the motor portion is a 1 to 5, and for the for the eyes it is a 1 to 4, the verbal is a 1 to 5, and the motor is a 1 to 6 scale. Okay, so that concludes the neurological exam that I have just performed on Mr. Joey. Have a great day. Thank you.